Okay, so Micah, on his way in, found a goat that looks like it has been hit by a car. So we're gonna go out, we're gonna check on the goat, we're gonna get it here safely and as stress-free as possible so that it can get looked over, and hopefully it'll be okay. Oh, baby doll. Easy, 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 easy. You're okay. Okay, y'all wanna come lay that on this side of her? Baby doll.
Just like this?
Yeah. Yeah, just ever so gently. Okay. There we go. It's okay. Oh, honey bunny. I hope you're not pregnant. That would be really sad.
I definitely feel like it is.
Come on, you're heavier than my freaking boy goat. Goodness, Mom.
Marty.
Yep. Are you comfortable riding back here with her? Okay. Oh, sweet love. Okay, Mama, we'll get you to Dr. Lydia.
It's okay. I got you. She's swallowing really hard, too. Well, you can get her out. We'll get her in there. Ready? Here we go, Mama.
Somebody hit you and just left you there.
She was swallowing super hard. I shall call you Gertrude. You like that name? You look like you got hit by Mike Tyson.
I think if she is gravid, she's early, so I think we can preg check her, but it's not my top priority.
You were in good shape before you got hit by a car, I think. You're super cute. You sorry that you got hit, Mama.
On exam, we do note that she has presumptive pulmonary edema, which is fluid in her lung fields. I hear it on both sides, but more on the right than the left. She does have trauma on both sides of her body, reportedly, and I haven't looked at the right side of her body in the hind end, but they think that she may have a broken right hind leg, and then the left side of her face has a lot of abrasions and swelling. So I'm concerned that she may have a fractured mandible, which is her jaw. We're gonna take some x-rays of her head and her lungs and her leg and kind of make a plan from where to go forwards. We are in a position where we don't legally own this goat. This is a stray animal. So as a veterinarian, I can provide care. I can legally give this sweet little thing some pain meds. So we gave her some anti-inflammatory pain medication to help. She is systemically stable, although she's very pale at this point. So she does have some epistaxis, which is a nosebleed, probably related to a contusion in her lungs or related to something going on up here. But she isn't in respiratory distress. Her heart rate's a little bit elevated, but it's not through the roof. So that's one of our best indicators of level of pain. She's really calm. She's letting us help her. She's drinking. So we're gonna go finish up our surgeries, let her pain medication kick in, and then we're gonna come back and do some more diagnostics on her. And hopefully we can get some pictures of her out quickly, and maybe we can find her owner, because we wanna be respectful, not to do anything with somebody's pet. She seems very sweet and comfortable with humans, so I think she is someone's pet. So yeah, she is comfortable. We're keeping a really close eye on her, and we'll let you know when we know more after we do those diagnostics.
Yeah. Her temperature dropped yesterday, and she saw the damage.
So Reese just got picked up. I kept calling her Reese. You know, Reese, whatever. She was our little pregnant mama that came in last week. We were kind of surprised she didn't already have her puppies, because it seemed like she was starting to show signs of possible imminent labor. But she decided to keep them in there for now. So hopefully, as soon as she gets to Megan's with High Forest, she will feel nice and comfortable and settle in and pop them all out. There's probably like at least 8 babies in there, maybe 9. So we're excited to see what they look like, because they're gonna be real cute.
They're gonna be so cute, so sweet.
She didn't seem to want to leave either.
No, she's super affectionate. I've been here the last 3 days, pretty much just me over here in the vet building. So I've been letting her hang out with me, and she just kind of like follows me around and just wanted to like sit as close as possible. So I think she just wants to be around somebody. She'll be a good adoption candidate after she has her puppy.
Maybe you should take her home.
No, I'm a boy dog person.
Yeah.
Maybe one of her puppies.
Yeah.
But, yeah.
Another normal day at Horse Plus, we had one of our adoptable animals get hurt in pasture. If you guys didn't see things this morning, this is Dr. Alex. She's a senior veterinary student and is wonderful. She's here with us for 3 weeks. So I'm actually gonna have her suture this horse's leg up today. So this is Blackberry. Blackberry came to us, I don't even know when, but if you need a really good blind buddy, this mare is the sweetest mare. She is wonderful. She has hurt herself a couple times here at Horse Plus, but it wasn't really her fault. It's changing circumstances around her, right? So life in a shelter for a blind animal can be pretty tough. She recently lost her long-term buddy, Whiskey, when he went home with his adoptive owner, which is wonderful. So today, she has a new pasture buddy. Her pasture buddy is due to see the farrier, and so we had to catch her friend, and she ran into the hay feeder. So she scraped her face up very superficially. She was irreversibly blind, and we removed both of her eyeballs when she came in several months ago. So that is stable. What she did do today that she's in here for is that she sustained this laceration over the inside of her right hind leg right here. It is mostly superficial, but this section right here in the middle is full skin thickness. So if someone sent me a picture of this and it had happened 3 days ago, I would say, keep it clean, it'll probably heal by second intention. But because we have vets on site and it just happened, the best thing to do for this is to sew this closed because it is through full skin thickness. So our plan is, we already sedated her a little bit. We cleaned this up. I'm gonna take lidocaine and bupivacaine, which are just both local numbing agents, and we're gonna block around the area so she can't feel it. Nobody wants to feel your stitches. And then Alex is gonna suture that middle part up and she should be just fine. So that should be good to go. I don't even think she needs antibiotics. We'll probably give her some anti-inflammatories for a couple days. This is mostly pretty superficial. So that is our plan, and we're trying to be quick because we have a lot of horses to look at today, and we just added this to our schedule.
We just got in 5 Mustangs from a wild horse rescue in Florida. They traveled all the way here. We're super grateful for that. And they surrendered these horses. Some of them have rough past, and they knew that Horse Plus would take good care of them. And we're excited for Dr. Lydia and the vet team to evaluate them and just see how they do. And they were super happy to get off the trailer after that long ride. So y'all stay tuned for these guys.
Hi, Gertrude. You're a good
Turn
girl.
our head this way. No, you're okay.
It's not looking great. This is definitely offset, like bony wise. Okay, let's take lateral the other direction. All right, we don't have a mandibular fracture. We might have a dislocated TMJ on the left side. I'm a little bit worried about that globe. That's a lot. We're gonna have to look at that eye. Yeah. That's a lot. If it's an animal, especially that I don't palpate a lot, I try to do both sides. Like when I palpated up here, I don't necessarily know exactly what a normal goat feels like, but I know that this goat's left and right should feel the same, right? So you can learn a tremendous amount from asymmetry. Acute is a little bit harder, but chronic, just look for muscle asymmetry. Like so often the body will show you exactly where the chronic pain is, just if you look at those muscles. Does that hurt, ma'am?
That left eye looks more swollen too than it did earlier.
It's huge. It
was swollen shut earlier.
I think she probably did get hit by a car. What I would like ideally is to lift her up enough to get a DP of the pelvis.
Okay.
Let's see if we can get,
Don't go anywhere. That's why I was wondering.
oh, she's knuckling over. Hang on. See the knuckling?
Yeah.
We've got nerve damage back here. Okay, there it is.
Oh, yep.
Pelvic fracture. Proprioceptive placing is, does my brain know where my body is in space? Yes. So you can still move a leg and still have nerve function from the brain to the leg, but not have nerve signals from the leg to the brain. So this goat has a signal from brain to leg. She can move the leg, she can feel the leg, but her brain doesn't know my leg is flopped over. And it's really simple in animals. If you take a foot that should be like this and you put it like this, and you can practice on your dog at home, they do not like to stand with their leg like this. They immediately put it back. If the brain feels the foot touch the ground like this, it's like, nope, I'm gonna put it back. So in this goat, she just stands here like this, right? So that's not a pain response. That's, my brain has no idea that my leg is in a weird spot. What is nice about this is these bones are close enough to each other that she has a chance of healing just as is. And if this were a dog with this injury, I would say 4 strict weeks of cage rest, like gently assist to stand up if they can't urinate laying down, and like recheck radiographs in a month and see. And like, I would say 60-70% of the time, a minor pelvic fracture, that's the only problem, heals. Nerve damage, totally different ballgame. So if we have permanent nerve damage, it's a major problem because you can't feel the leg and you're going to drag that sucker around. In this little goat's case, it's way too early for us to tell if that damage is because she has a lot of swelling secondary to an injury that probably happened within the last 12 hours based on the bleeding. We don't know, right? So we also don't own this goat. Our job is to make sure she doesn't suffer and stabilize her. She is drinking, which is great. She's not eating, which isn't great. But we can keep her well hydrated and keep her pain managed and kind of see where we go from there, as long as things don't change. So basically, in a nutshell, her pelvis is broken. It's broken on the right side near the acetabulum of the hip, which is where the socket and the ball join together. Thankfully, the fracture isn't in this part, it's over here. But anytime she puts any weight on this leg, it's gonna put pressure right on the line of this fracture right here. So that's what we know. I don't think her jaw is broken. I do think it might be out of the TMJ joint, the temporomandibular joint. That's where the little hook that comes up on the jaw communicates with the upper part of the skull. And I have no experience replacing a out of joint TMJ, but we will look at that further. What I didn't do earlier was try to manipulate her jaw at all or palpate in there. One, because she was really painful. Two, because if her jaw was broken and I'm messing around with those bones, it's contraindicated. So now that we know there's no mandibular fracture, we can go back in and put our fingers in her mouth and try to move things around a little bit, see what we find. It is so hot.
Hi. How are you?
Mari, what's the story on this little guy?
So someone brought him in because this sweet, I'm not sure if it's a girl or a boy, hopped right up to them at their house, and no one claimed them. They posted him everywhere on social media, on Lost Pets and everything. They thought it might have been like someone nearby, like a neighbor's, but no one claimed him. It could have been that the owner released him out, thought that they could fend on its own, or just got lost. It's more likely that someone released him thinking he could fend on his own, but she was super sweet and called us up and wanted to make sure that this little one found a good home, so she brought her in, and we're super happy because she's so cuddly. My goodness. Yeah. So now we've got a cute little rabbit.
All right, we are out here with our 4 relatively new owner surrenders, and we got to do their intakes today.
So they got their vaccines and physical exams and microchipped. And so far, based on our initial findings, everyone is looking pretty decent. We're really, really hopeful that they'll be able to make it to adoption. A couple of them are gonna need some radiographs done, a couple pocks and some other things we wanted to look at. They do have some conjunctivitis going on right now, which is pink eye. That's why we have this beautiful patriotic fly mask on, and I think
And
all
also
of them
because it was just
also,
the 4th of July?
Yes, that's why it's patriotic. But yeah, overall, they're looking pretty good. They're real sweet, as you can see. They're all really sweet. They're just really occupied by grass right now.
I don't know the gentleman, I didn't speak to him, but I'm so thankful when owners choose to release their animals into a situation like Horse Plus. Our goal is to get as many animals adopted as possible and also to make sure horses don't make it into the slaughter pipeline. And it's unfortunate how often sweet animals that have plenty of life left fall into the wrong hands, and that can happen so easily. So we're really thankful that their owner made the decision to retire these guys here so we can find them new homes. They all have names, but they all have kind of similar names, and it's been a long day, so
We're
really
struggling.
sorry. But keep an eye out for these guys. I feel highly optimistic that all 4 of them are gonna make it to adoption.
Oreo was just adopted by Megan, who works for High Forest Humane Society, who partners with Horse Plus Humane Society. And we're really excited that Oreo found such a wonderful home. Sounds like Megan already has some bunnies at her house, so she knows how to take care of them. And I think Oreo's gonna have a great home with the other bunnies and guinea pigs.
So today it is after lunch and we have an adoption. They called yesterday and they did have an approved application, so we were so excited. These guys are going to give a horse a lovely family, and they came with a trailer, so we're hoping that someone can find their forever home today. This is Cody. She's our horse trainer here.
All right. They're okay to come in.
Yeah, they can come in. So her name is Ayani. Both of these horses are from out west, from the reservation. Dawn, she's throwing dirt on you, ain't she? And she's a mess. We love her, but we're messing with her now because she's got a personality. Dawn, are you our little diva? Now you ain't gotta be a little diva. You're too little to be a diva. No. Dawn Olivieri, she's an actor on Yellowstone. She went to her rescue, and then they were transferred here because she's like, hey, I've got a lot of horses, and we're like, great, we've loved some Dawn Olivieri horses, you know, so you're my little diva, aren't you? Our little diva. I mean,
Yeah, he brought his own $3. He's ready to buy a horse.
I mean, what kind of deal is that? Come on now. Have you got a new home? Are you gonna go to him?
You guys are a good girl. I think it was a Facebook post. She had found you guys online, and we just started looking you up, kind of learning a little bit more about you guys, what you did. She started following a lot of the posts about the big lick issues, and so we just started kind of following along, seeing what was going on there, and then we started seeing who you had up for adoption, and just kind of watching to see if anything kind of showed up that kind of met what we were looking for. And one day we decided, hey, let's just go ahead and put the application in. We'll at least go out there and see what's out there, and even if not on the first trip, maybe on another trip we can find somebody that fits in with our herd. It actually wasn't until day before yesterday that we learned about Dawn. I had been looking at Ayani and Kiona for a couple weeks, just because of what I was looking for more horse-wise, with something that have a little bit more natural cow instinct, or something that'd be a little closer to a thoroughbred or a quarter horse. Yes. And the fact that they were both Mustangs from out west, I'd noticed Ayani's tattoo, and that really piqued the interest. But then when I called and started talking to everybody is when I learned about Dawn.
She's so cute.
And so that then opened the possibilities of another horse that could kind of grow with the youngins, and they could get involved with the training aspect and kind of have something that they grow with and build that bond with. So that's kind of what drew us to the two of them was that aspect.
We love what you guys do. We appreciate it so much.
We have a really sad update for you guys. This is Gertrude. On Tuesday, we identified that she had a really swollen eye, some swelling in her mouth, some fluid in her lungs, and a fracture in her pelvis. So the pelvis is kind of like a box of bones, and then off the side of it, the hind legs, the femurs kind of attach in the hips. So this was a great learning experience. Poor Alex. So Alex is our wonderful senior veterinary student here, and I'm so thankful for people fresh out of school because they help us learn new things, but also help us miss things. So we had a busy day on Tuesday. We took radiographs. We saw a great view of most of the pelvis, but not all of the left side of the pelvis. Saw the fracture, and we were like, there it is. There's our fracture line. And so we designed a treatment plan. Our staff worked really hard and were able to identify her owners, which we're very thankful for. They were a lovely family, and they were able to come say goodbye to Gertrude, but they didn't have the capacity to provide her with the veterinary care that was needed, so they surrendered her to Horse Plus. So today, in preparation for our weekend, one of our staff members was gonna take her home and care for her. She's not able to get up. And I said, let's recheck that pelvis and that fracture before we move her and send her anywhere. And unfortunately, in performing that recheck exam, we were able to get a better view of the pelvis, and we found a second pelvic fracture. So that is really important, because if you think about a square, if you have a break in one point of the square, you still have stability provided by the rest of it. But if you have a break here and a break here, then you have two separate parts with no stability. So that's exactly what happened with Gertrude. So yesterday, when we had a little bit of a fracture that was like this, our exam today was like this, where we have had the pelvis actually moved on both sides. That's important because if bones are lined up enough together that the marrow cavity and the exterior part of the bone and all of those stem cells that create bridges, if they can talk to each other, they'll make a bridge and they'll heal a bone. There's a joke with cats that says, put the two bones in the same room together and they'll heal, or something like that. But what we want with fracture healing is for really good apposition of those two bones. And yesterday we had pretty decent apposition. I went, this one fracture line, we got a good chance of it healing if she just rests. Today that is no longer the case. Without placing extensive plates and screws, which is orthopedic surgery, you open the whole area up, you get a sterile stainless steel plate and you screw it into place to stabilize those. And if you've ever had extensive surgery on your pelvis or somewhere else, you see those x-rays with humans. That is not something that we have the ability to do here at Horse Plus. We're a general practice. I'm a GP. So I would never attempt that procedure on an animal. I've never done that kind of surgery. I'm not qualified to do that kind of surgery. And it would have to be done on both sides. So we took a decent prognosis to a very painful displaced fracture with no chance to provide her with the care that she needs here at Horse Plus. I'm so thankful that she didn't pass in the middle of the road. She had great pain medication. She's been on a nice orthopedic dog bed, and she's gotten a lot of love and care and got to say goodbye to her family. So we are making the decision to recommend the last act of kindness for Gertrude. We do not want her to suffer, and her pain is gonna continue, and her chances of those bones healing went from pretty good to almost zero. So not the update that we wanted to give you guys at all, but that's also why we're here. I'm thankful that we got answers and that we're able to give Gertrude a last comfortable morning and some groceries. She started eating again. She wasn't eating at first, she's eating now. So we've seen some improvement, and we're gonna say goodbye.
Next week is buyout, and we need your support to help rescue, shelter, and protect horses. We're getting between 20 and 30 horses coming in, and these horses are coming in horrific condition. If you've been following our buyouts, we're getting horses in that have been through multiple auctions. And we know this because they have multiple auction tags on their bodies where like one tag was ripped off and you can see the remnants of it left behind on the horse with the glue. And these horses, we're testing them, they're coming up with zoonotic diseases. So you see us wearing the protective gear, and that's because we're getting horses that have diseases that humans can get. We've had multiple cases of diphtheria, and horses can only get this diphtheria with long exposures to humans that are sick. We know that there are trailers coming back from the U.S.-Mexico border, and they're transporting horses, and we have witnesses that have told us a lot of different things. And from what we know, with people coming forward and letting us know the reality of what's happening is within the horse slaughter pipeline, there's drug smuggling, there's human trafficking, and humans are being loaded up in trailers with horses and trailered into the United States. And if there's somebody sick that has diphtheria and they're standing in a semi and there's a cut gate and there's people over here and there's horses right here, and they're sick and they're coughing, those horses will get the diphtheria. And so there's a lot of behind the scenes going on. We are deeply in an investigation, and we need your support, not only to help rescue these horses that we have the opportunity to save, that will continue to help us with this investigation into the zoonotic diseases, but there's just a lot going on right now as we are in the fight to end the brutality that's happening to horses. So please donate and help us. I know our team has been extremely busy trying to help all the horses, and last week we were in the reservation with the Wild Horse Res Challenge, placing horses with Navajo gentlers to be trained. There's a lot going on, but definitely please support us so we can rescue these horses, as if we don't have the funds to save them, we can't responsibly rescue them. And we want to say yes to each and every one. To donate, just go to our website, horseplus.org, and click on the donation page. You can fill out the amount you'd like to donate. It costs typically about $1,000 for us to rescue a horse and give it its initial intake and care. Be sure to subscribe to this channel if you're not subscribed already, so you don't miss any of our updates as we help these horses and update you about the investigations that are happening with the slaughter pipeline. It's pretty horrific.